Hi, Miss Brian. How are you today?
Good, how are you doing?
Good. My name is Beverly. I'll be your PA today.
Nice to meet you.
What's bringing you in today?
I'm scared that I might have an STD, but I'm not sure.
Okay. How long have you been feeling this way?
I just noticed it like a couple days ago, so I don't
Okay.
know.
Okay, what makes you think that you have an STD?
I've been having these they're just like little sores like in my down there region, and but I couldn't tell if it was just like razor burn or not, so I wasn't sure.
So you waited a few days before coming in?
Mm-hmm.
Okay. Have you ever had these before?
No.
No? What were you doing when you first noticed them?
What actually happened was I was showering and it like stung a little bit. The water stung a little bit.
Okay.
So that's when I noticed it. But other than that, I noticed it the one day.
Okay. Have you done anything that makes it better or worse?
No, because I was just gonna wait because I thought maybe it was just like razor burn bumps, and then I just decided to come in today because just wanted to make sure.
Okay. Has it progressed any over the last few days?
Not really. It just I feel like, a couple days ago I didn't notice it, and then it's two or 3 days ago is when I noticed it. So it might have gotten a little bit worse, but not like a lot worse.
Okay. How would you describe them?
Well, they're not painful except when sometimes when I pee it hurts a little bit too. But other than that, I don't really have pain with it, or they're just kind of little reddish spots.
Okay. If you say you don't have pain, on a 1 to 10 scale, with 10 being the worst, how much is it bothering you?
It's not really bothering me that much. It's just like I said, when I pee, it stings, and it's I don't know, knowing that they're there, it's just kind of discomforting.
Okay, so those are the peeing and just knowing that they're there is the only thing bothering you. It's not, is it affecting any of your other daily activities?
No, not really.
Okay. Are they only in your vagina area, or are they spreading?
No, they're just there.
Okay. And you said this happened about 2 days ago?
Mm-hmm.
Okay. Are there any other symptoms that you want to tell me about, or?
Not really, no.
Okay. So, are you allergic to any medications, environmental factors, drugs?
Mm-mm.
Are you on any medications currently?
Just birth control.
Okay. I'm going to take a little bit of your history now, other than the symptoms that you just told me about. Tell me about any other medical history. So, did you have any childhood diseases or disorders?
Mm-mm. Nope.
Did you ever have mumps?
No.
Measles?
Mm-mm.
Rubella?
Mm-mm.
Scarlet fever?
Mm-mm.
Rheumatic fever?
No.
Did you get the vaccines for these?
Yeah.
Okay.
Mm-hmm. I did have chickenpox though, but I got the chickenpox vaccine too. So.
Okay. Have you been hospitalized before?
Overnight or?
Yes.
No, not overnight. I had surgery.
What surgeries did you have?
I had a knee surgery and I had my wisdom teeth taken out, but they were all outpatient. So.
Okay. How old were you when you got your wisdom teeth taken out?
I was, I think, 16, and then my knee surgery was when I was 18.
Okay. What hospital did you go to?
Lancaster Regional.
Okay. Were there any complications with either of these surgeries?
Nope.
No. Have you been involved in any other accidents or injuries that you know of?
Mm-mm.
No. Have you ever talked to anyone or been diagnosed with any psychiatric disorders?
No.
No. Okay. So when was your first menstrual period?
When I was 15, I think.
Okay. Would you say that they're regular?
Mm-hmm.
Okay. Do you visit a gynecologist annually?
Mm-hmm.
Yes. When was your last appointment you had?
January.
Okay. When you go to the gynecologist, do you have pap smears annually?
Yeah.
Yes?
Mm-hmm.
Okay. And the last time you had one, were there any abnormalities?
Nope.
No? Okay. Are you currently sexually active?
Yes.
Okay. How long have you been sexually active?
Well, I just broke up with my boyfriend, and like probably a month ago, and then probably like 2 or 3 weeks ago I saw him again, and we had sex again, which is why I'm scared, because I think that maybe he was with someone else.
Oh, okay. When you guys have sex, do you use any protection?
Usually.
Did you use it the last time you saw him? No. Okay. Are you on any birth control, or do you use any other forms of contraceptive?
We usually use condoms, and I'm on the birth control, but other than that, that's it.
No. Do you take your birth control regularly?
Mhm.
Okay. Is the birth control the only medication you're on?
Yeah.
Okay. So I'm gonna ask you about your family history.
Okay.
So this doesn't have to do with your symptoms. I just want to get a full history for you. Are both your parents living?
Yes.
Okay. Do you have a mother and a father?
Yes.
Well, how old is your mom?
She is 48.
Okay. Does she have any outstanding medical disorders?
No. Her side of the family has thyroid issues, but other than that.
Okay. What about your father? How old is he?
He's 50.
Okay. And does he have any disease? No. And do you have any kids?
No.
Okay. Do you have are your grandparents living?
Yes.
Okay.
Well, on my dad's side, yeah.
Okay. How old are they?
75, 78,
Okay,
something.
that's fine. Do they have any outstanding medical conditions?
I think my grandpa is hypertensive. My dad's mom died of cancer. She had bladder cancer, so she's not living. But
Okay.
I have a step grandma.
Okay. I'm gonna run through first a list of disorders and diseases for yourself, and it may sound repetitive, but just say if you've experienced them before, or if you haven't. Okay.
Okay.
So this is just for you. Have you ever experienced diabetes, hypertension, coronary artery disease, COPD or asthma? Do you have any thyroid disorders?
No.
Renal disorders? No. Okay. And then this list is for your family, so it's kind of like the same thing. It's just a little bit more. So does anyone in your family have any allergies?
Not that I know of, no.
What about asthma? Cancer?
My grandma on my mom's side had ovarian cancer. My dad's had bladder. That's it.
Okay. Does anyone have COPD?
No.
Coronary artery? Okay. Has anyone had diabetes?
I think some of my aunts have some diabetes.
Okay. What about dyslipidemia? No. Do you know of any genetic disorders in your family? No. How about migraines? Mental illnesses? Has anyone ever had a seizure?
No.
Any history of substance abuse?
Nope.
Strokes? Suicide?
No.
Okay. Are there any thyroid disorders? You did say on your mom's side,
Just
right?
my mom's side, yeah.
Okay.
I don't know if there's a specific disease or whatever.
Okay, that's fine. What about any tuberculosis?
No.
No. Okay. So now I'm going to move on and ask you about your social history. So what would you like to say that your interests or hobbies are?
I play lacrosse. I study.
Okay.
I like to swim. I like to travel.
Okay. So you say you study. Are you a student?
Mm-hmm.
Okay. Where do you go?
I go to Philadelphia University.
Okay. What year are you?
I am in my first year of grad school in the PA program.
Okay. That's really cool. Who do you live with?
I live with my 3 roommates.
Okay. Do you live on campus or do you commute?
Off campus, I commute.
Okay. So you drive to school every day?
Mm-hmm.
Do you wear your seatbelt?
Yes.
And in your house with your roommates, how many floors is it?
2.
Okay.
3 floors.
Okay. Do you guys have fire extinguishers or smoke detectors, stuff like that? Okay. Then do you, where were you born?
I was born in Hershey.
In Hershey, Pennsylvania?
Yeah.
Okay. What would you say your ethnicity is?
Caucasian.
Okay. So you're okay, keep going.
I have a little bit Italian, some
Okay.
British, and Irish.
Just all types of things.
Yeah.
Okay. So you said you're in the first year of grad school.
Mm-hmm.
Do you have a job right now?
No.
No. What have you had any previous jobs?
I was a lacrosse coach.
Okay. So you just broke up with your boyfriend? How would you say your support system has been with your friends and family?
Good.
Good.
They're great.
How would you? Do you use any vitamins?
Sometimes.
Okay. Do you use any laxatives?
No.
Any sedatives? How would you describe your eating habits?
Pretty good.
Okay. What would you consider good?
In the morning I usually eat breakfast. I'll have like a fruit and like rice cake or something.
Okay.
Lunch I'll have like a sandwich and like chips or something. And then dinner I'll have like chicken and a veggie or pasta.
Okay. Since you're in school, how would you describe your sleeping habits?
I get probably 6 hours of sleep a night.
Okay. Okay. And what about your exercise?
Well, I play lacrosse, but I haven't been able to go that much, so.
Okay. And how's your caffeine intake?
I probably drank like either a cup of coffee and a cup of tea every day, or 2 coffees, or.
Okay. What about your alcohol consumption? Do you drink? I see you just turned 21.
I drink probably like once a week, if that.
Okay. What about tobacco? Do you use any tobacco? No. Any recreational or illicit drugs?
Nope.
No? Okay. Okay. I'm going to run through a few of general symptoms to see if you've had them in the last 6 months. They're just yes or no questions. It may seem like I'm coming at you with a lot of stuff, but just say if you've experienced them in the last 6 months or not, okay? So this is your normal weight that the nurses took. Is that what you normally weigh?
Mm-hmm.
Okay. Has there been any weight changes recently?
Nope.
No? Have you been experiencing any fatigue?
No.
Weakness?
Mm-mm.
Malaise?
Mm-mm.
Do you have any fevers?
No.
Or night sweats?
No.
Chills?
Mm-mm.
Have you had any loss of appetite?
No.
Okay. And for your skin, have you noticed any color or texture changes?
No, just the thing that I said.
The bumps. Okay. What about your hair? Have you experienced any changes in your hairs or your nails?
Mm-mm.
Have you noticed any, other than what we talked about earlier, have you noticed any lesions,
Mm-mm.
lumps,
No.
rashes?
Mm-mm.
Has any of your skin been dry or oily?
Nope.
No. Has it been itching any?
Mm-mm.
Does down your vagina area, does that itch?
Not really, no.
And you said there's no pain either?
No.
Okay. Now for your eyes, do you wear contacts or glasses?
No.
No? Okay. Have you experienced any blurry vision lately?
Mm-mm.
Been seeing double?
No.
Are you ever sensitive to light?
Nope.
Do you ever see like little floaters in the air?
Mm-mm.
Have you seen any redness?
No.
Pain?
Nope.
Have you been noticing any excess tearing
Mm-mm.
or discharge?
No.
Have you ever experienced any surgery
No.
or trauma to your eye?
Nope.
No? Okay. Well, I think that completes our entire history for you, and we're going to see if we can help you out with what you've been experiencing.
Okay.
Okay?
Thank you.
Thank you. Was that too long?